Welcome to our series, Understanding Cancer, the Truth, Treatment, and Myths with the John Wentworth Cancer Center, located on East Route 34 in Sandwich. Call the John Wentworth Cancer Center at 815-570-5006. On today's program, we are pleased to be joined once again by Dr. Kevin Cater of the John Wentworth Cancer Center. Dr. Cater, how are you doing today?
I'm doing very well.
Today we're going to talk about head and neck exams and the importance of such exams of this type. This is an area where some people, I think, kind of take it for granted, but there's more and more research out there that states the importance of head and neck exams, right?
Yeah, that's exactly correct. I think head and neck cancer is one of the cancers where the incidence is going up dramatically. So it's one of those where we're seeing much more head and neck cancer. And the thing about it is that you can actually look and see if you have head and neck cancer. And so presumably you can catch it early. Mm-hmm. But what we're also finding is that people aren't taking advantage of that. So when we see the patients, the head and neck cancers are more advanced than what they needed to be.
Any reason why there's been such an increase? Is it just the way our lifestyles are these days? We're exposed to more things, or we're exposing ourselves when we shouldn't? I come to think of things like, sunburns and, radiation from the sun, around the head and neck areas. But are there other causes out there also?
Yeah, absolutely. So there are two ways that you can develop a head and neck cancer. Mm-hmm. Alcohol use and tobacco use causes head and neck cancer, and then viruses also cause head and neck cancer. So you can actually be a non-smoker, non-drinker, and still develop a head and neck cancer.
Never realized that, a virus of some sort. Huh?
Yes, and so it's the virus side of the equation where we're seeing this kind of a skyrocketing.
I obviously figured smokers, but I forgot about alcohol being, and that's one of the other things also I guess I never really gave much thought to. And does that pertain to just heavy drinkers, or even moderate drinkers are susceptible to this?
It's usually your heavy drinkers, and that's probably why head and neck cancer doesn't get as much funding, research, and discussion, because it's not associated with tumors that are seen in the general population. There's kind of a misnomer that it's seen in somebody who uses alcohol and uses cigarettes to an excess.
Sure.
And that's not true. Again, you can absolutely develop a head and neck cancer due to the virus side of the equation.
What about exams? How are the exams done? Can a doctor such as yourself just look at somebody's head or neck area and say, looks like you maybe have something going on here, or does it require something like an X-ray or MRI or what?
Sadly, I've diagnosed head and neck cancer just on the street looking at somebody's neck lymph nodes. Now, that's somebody that's very advanced.
Okay.
I could hear their hoarseness of their voice, and I could see the neck lymph nodes that were enlarged. And in a very tactful sort of way, I had to tell this person to go see a doctor. But that, again, is very advanced. Dentists and oral surgeons are very, very good, and dental hygienists, too, are very, very good at doing head and neck exams. And so they can identify lesions in the oral cavity, in the mouth, and in the back of the throat very early. So seeing your dentist and your dental hygienist. Also, if you have a poorly healing ulcer in your mouth or in your head and neck area, or if you feel a rock-hard lymph node in the neck, you want to bring that to the attention of your doctor.
So again, various reasons, and again, various factors, causal factors to watch out for head and neck cancers. But again, if you're one of these people in this group here, you might want to get an exam if you haven't already, just to make sure that if there is something going on there, try to catch it early, right?
That's exactly correct. And the other thing that you can do is there is a vaccine for cervical cancer, and that same vaccine will protect you against head and neck cancer. So the vaccine is called Gardasil. It's given to girls or women of teenage years. That's when you have to be given the vaccine in order for it to be effective. And now, because it protects against head and neck cancers, we're also recommending it for boys or teenage boys.
Interesting. I'd never heard about that. Well, Doctor, we are out of time on today's program. A pleasure visiting with you once again, and we'll see you back here again next week then, okay?
Thank you.
All right. Our pleasure. Dr. Kevin Cater. Join us next week for our series called Understanding Cancer, the Truths, Treatment, and Myths with the John Wentworth Cancer Center, located on East Route 34 in Sandwich. Call the John Wentworth Cancer Center at 815-570-5006.